Welcome back to Community Conversations. I'm your host, Steve Mantis, and my guest today is Matt Shaw, a local occupational therapist. So Matt, as I mentioned earlier, we've known each other for some years. I consider you one of my big supporters to overcome the problems I've had and keep me active. I'm going to cover a few things in this last segment. The one, we talked about how that dynamic at work plays out. And I know I'm active with injured workers and the workers' compensation system. You know, the thrust right now is to get you back to work as fast as we can. How does that work with shoulder injuries? What is that successful in that rapid return to work?
Yeah, I think there is an increased awareness that you have to treat people have shoulder pain with discretion, and that includes productive work. Often we're spending the majority of our time where we're using our shoulders in a work setting. It's rarely because you're bowling, and it's rarely because you ride your motorcycle on the weekend, and it's rarely the 1 to 2 hours a week where you're swinging an axe to chop firewood where you're incurring these kind of injuries. It's normally the repetitive, forceful movements of your shoulder. There is an awareness that those can go badly wrong if you force a person past their tolerances, past their capacity for this. There's usually a downward spiral if people persist with shoulder pain and try and work through it.
Well, it's interesting. I was in Toronto last week at an international conference, and I also addressed one of the classes at the University of Toronto, the human resource professionals. And when we talked about how to really support a person, I recalled a story you told me once where the worker had just had surgery, really needed that rest. It wasn't appropriate to go back to work. And it was winter time here. We got a lot of snow, and you mentioned, well, if the employer really cared, they'd have someone plow the guy's driveway, because otherwise he could be out there trying to plow it, clear it himself.
Yes.
So it's not only recognizing the 40 hours you're at work, but also the activities that you have to perform in your daily life just to kind of keep the road open or food on the table.
Yeah, it's slow going in terms of educating people who haven't been through the process before themselves.
Yes.
And nobody really knows what you go through. For instance, if you have a shoulder injury or you're having to go through the rehabilitation process, people who haven't experienced that have a hard time knowing that it's difficult even to dress in the morning.
Yeah.
So when you're having someone come into work with a shoulder that's painful and not very functional, but they still have to make lunches for their kids, get their kids on the bus, dress themselves, take care of yard work, doing everything else that we kind of take for granted with two shoulders. And that's usually a learning process. Once one employee kind of goes through it, there's usually a greater awareness for the next person. But it's a lose-lose situation to have someone maintain their usual productivity at work when they've had an injury to their shoulder. It's just not a good situation to get in. Usually ends up with a downward spiral, people being chronically disabled because of that, or having to have surgery, having a reduced quality of life for sure.
So Matt, you've been specializing in this area of
Yes.
hands and arms, shoulders,
Yes.
and you're recognized really as an expert in this area. You've got some new things you're doing locally to try to increase that knowledge across the healthcare sector. Tell me a little bit about that.
Yes, part of what we're doing is something called the Northern Ontario Shoulder School. So this is an initiative that a team of occupational therapists, physiotherapists, and orthopedic surgeons have put together to prepare people for surgery. Shoulder surgery is a complex surgical procedure, but it's also complex in terms of the rehabilitation, as well as it's a difficult scenario for people who are attempting to rehab their shoulder. So we have an initiative where we are going to put together a program, and we're halfway through this. We're going to have the physiotherapists and occupational therapists in Thunder Bay. It'll be a train-the-trainer workshop, and we're going to be doing webcasts as well as live shoulder school to better prepare and educate people who are going to be having shoulder surgery. That should be starting up in the spring.
So you're going to be first kind of training other healthcare professionals and then move into the school will be for people scheduled for surgery.
That's right. This is Dr. Tracy Wilson, who's one of our orthopedic surgeons who deals with the shoulder. She feels that this initiative will help open up the channels of communication with the local physiotherapy clinics and physiotherapists. We'll have a common approach in managing patients who have had shoulder surgery, as well as we've been finding through the years that there's a gap in people's knowledge about when they can start to move their shoulder. We'll be showing them techniques to shower, to how to drive, how to manage pain, the basics of their therapy, those kind of things, and they'll be able to access a physiotherapist 24/7 after their surgery to ask questions.
So, okay, so we'll put a link onto the website, so you guys have a new website for that.
That would be helpful.
We'll put a link on underneath the screen here.
Great.
And there's another thing you're doing too, I think,
Yes.
around educating other healthcare professionals.
Yes, through my particular facility, the Hand and Upper Limb Clinic, we have a hand interest group. We have a new hand surgeon in town. We have 2 hand surgeons in town who do quite complex reconstructive surgeries on the hand and wrist. And this is another collaboration that we have with the surgeons and other allied health professionals like OTs, physios, nursing, and medical students. It's an informal seminar type of setting where we have a hand surgeon or a radiologist present on a topic of interest related to the hand, and people are invited to come out, and we have a round table discussion, again, to encourage collaboration amongst the allied health care professionals and the surgeons and specialists working in the field.
Well, Matt, I want to thank you so much for coming on the show
Thanks
and
for
sharing
inviting
your
me.
information. I want to engage you, our listeners, our audience out there, in furthering the education. We've got a Facebook page. We'll have a little picture of Matt on the page. Tell us your story. Ask for advice. I see Matt on a regular basis, and if he's not responding on Facebook, I'll give him the needle, and we'll try to get that engaged. Because this is all about really lifelong learning, and so we really want your opinions, your stories, your questions about the topic at hand. And if you have suggestions about other topics you'd like to see us cover on the show, we welcome those as well. Thank you very much for tuning in, and once again, thank you, Matt, for being a guest.
Thanks,
And
Steve.
we'll see you again next week.
That's what we all gotta say.